I am Dr. Ayan Dey, a consultant nephrologist here at PD Hinduja Hospital. And today I've chosen to have a seminar on a very important and very relevant topic in our day-to-day life, which is creating awareness about kidney disease and knowing a bit about how we prevent kidney diseases from happening. Give me a minute while I share the screen. So as I was saying, the kidneys do play an important role in so many of homeostasis and maintaining the body with regulating so many important organs and blood pressures. And so it has an important role in management and daily care of the human body. So if the kidneys start failing, or rather should I say, if we have some kidney problems, then what are the signs and symptoms that you can start seeing? We do notice a reduced urine output. That is something which we see. If patients start feeling more fatigue, nausea, swelling in the feet, I will explain more as the presentation goes on as to why does that happen. Tiredness, poor sleep, poor appetite, unexplained itchiness, puffiness of the face and the eyes. Normally, when you get up after a good night's sleep, if you notice too much of facial puffiness, that could be one of the indicators, and shortness of breath. Again, as I will explain further, kidney disease and kidney problems are a spectrum. So we can have some mild problems, and when we progress over the years or months, even in some cases, then as the kidneys start failing more and more, these symptoms become more pronounced. Now, I'm sure you all are a little bit aware about what the kidney reports are. And when you go to your doctor, if your doctor does say to get a few tests done, you kind of have an idea as to which of these are your liver tests or your kidney tests or your hemoglobin tests. So just a bit about trying to make you all understand a bit further is we do check something called as creatinine, which is a byproduct of muscle metabolism, which is happening in our whole body. So happens at a constant rate, and it gets excreted from the kidneys at a constant rate as well. So if our kidneys, which actually act like filters to keep the good stuff in and pee out the toxins and other materials, if the kidneys do not work well, then there is an accumulation of these waste products in the blood. Creatinine has been shown to be of a quick test on the blood, which kind of correlates with how much the problem is, and the levels of creatinine, when they start going up above their normal range of lab values, it suggests that you might be having kidney problems. The other thing which a lot of our patients also come in with is, now the labs have started reporting something called as a GFR. So what is it? It's basically a glomerular filtration rate. As you are aware, we have two kidneys, and these kidneys ultrastructurally, if we go into the microscope and see, have something called as a nephron, which is a small part, a small filter, and there are millions of them which make the kidney. And a part of that is the glomerulus, which is actual filter. So basically, with the blood tests and with putting them into some equations, we get to know how these glomeruli are filtering and at what rate. So that is a very simplified way of telling how good or bad your kidneys are. And as you can see, a very pictorial diagram of a normal kidney has a GFR of around 100 to 120 ml per minute per your body surface area standardized. And as the GFR starts falling, it is an indication of your kidney disease worsening. You all must be aware that the normal value ranges somewhere between 0.6 to 1.2, though the lab values differ from each lab to another, but the rough guide is somewhere around this figure. And so if you start having a creatinine which kind of goes above 1.2, 1.3, 1.4, then I think it's a good idea for you to get a little more aware of what's going on and probably ask your physician or your nephrologist as to what are the things that you can do to prevent this from worsening further. Now, when we talk about kidney problems, there are two kinds basically. One is an acute kidney injury, which is basically if for any reason you get dehydrated, you have a heart issue, you have taken medications over the counters that can harm the kidneys. It's basically over a short period of time, your kidneys have got hit. And so this is something which needs to be tackled by your physician, your nephrologist, or when you get admitted, or even if you are not admitted, to keep a close watch on why this happened and what could be done to bring it back to normal values. The one which we all need to know a bit further is what is called as a chronic kidney disease. As we just said about GFR being around 120, 100 to 120 being normal, you can see that once the GFR starts going below 90, and this is something which is calculated based on your creatinine value, and it's put into equations which have been standardized worldwide to give us an idea as to how much the GFR is. So if in your report, lab report, you see that your GFR is somewhere between 90 to 60, then you should be cognizant that probably there is some kidney issue that you have to deal with and you have to take control of the situation. Of course, as I will explain further, despite being absolutely proactive from your end as well, and from the doctor's perspective as well, it is possible that as you age, the creatinine might slowly start creeping up, and that starts reflected in the GFR as well. And some patients do go through these stages of kidney disease and have kidney failure, or what we say is end stage renal disease, and they might need dialysis or transplant. And as I said, this is chronic kidney disease, apologies, which is over a period of time, months to years, while the acute kidney issues are something which happens in a short duration. So we will now focus on chronic kidney disease to understand what that is and how can we prevent it. If some of the patients already have a chronic kidney issue, then what are the steps that we can take to try to retard the progression of CKD as the years go by? Now, it is an important condition which affects a lot of people, and its prevalence is going higher and higher as the years go by. It incorporates two very important things. One is the kidney function reports, which I said, the creatinine and the GFR, and also passing of protein in the urine. I will allude to that later in my presentation. And the Indian data says that roughly around 5% of asymptomatic low-risk patients, patients who don't have any issues, any diabetes, blood pressure, any family history of kidney issues, also could be having CKD. And as I said, this estimate is definitely higher in our diabetes and high blood pressure population. And if we look at some of the data, then roughly 17% of patients have some form of kidney disease. So out of 5 patients, it's probably one of us could be having a chronic kidney issue to deal with, which is a big number. Of course, a lot of articles come up in newspapers, leading journals, leading newspapers. And one of the things that my patients, when they come to me, say is, Sir, I've been fine over all these years, and suddenly for a routine blood checkup, or probably for just an annual health checkup, which we tried, or in a screening process, we found that our creatinine is 1.4, 1.5. Some of them even in the first instance have a very high creatinine to begin with. And that's why it's called a silent killer, wherein it strikes without warning. Again, just as I said, 10% of adults in India are at risk of developing kidney disease, which is a big number given our population. And that is why we all should know what kidney diseases are, what we can do to prevent them. Now, the two commonest causes of kidney disease would be high blood pressure and diabetes. And I'm sure you all must have heard in various fora that the prevalence of both diabetes and high blood pressure are going up and up. As much as it is now thought that around 1 in 4 of men and women included could be having high blood pressure later in their life. So the figure that I quoted earlier could be even more if we were to actually do the blood tests of all of our people in our country, then probably the prevalence of kidney disease would be even higher than what we are now saying. Again, as I just said, blood pressure, diabetes, smoking, high body weight, and heart diseases are some of the commonest causes which contribute to kidney disease. So if you who are listening do have diabetes, blood pressure, any heart problems, are overweight, if you have a family history of any kidney disease in your parents, in your siblings, if you are a smoker, and especially if you are elderly, then I think it's a very good idea to at least screen yourself for the presence or absence of any kidney problems. Like I said, the GFR that we calculated at the beginning, if it's more than 90, and it comes with the report nowadays, which is great. The labs have started reporting them. If not, then you can always go to your physician and you can ask them about this and they will calculate it for you as well. But if it's more than 90, then still, if you are a diabetic or a hypertensive or have high risk factors, you need to monitor. But definitely as the number goes down, it basically tells you that your kidneys are filtering less and less. And so you have to start becoming more cognizant and see your nephrologist as well at some point of time. Now, regarding the awareness of kidney disease, I want all of you to ask yourselves these questions. Have you ever been told by your doctor that you have a weak or a failing kidney or any form of kidney disease? Do you have any kidney problem, any kidney damage of any kind, or any passage of protein in your urine? If the question to these are yes, then look back at your lab reports, look what your creatinine is, look as to do you pass protein in your urine or not, and then take it forward with your physician or with your nephrologist as to what more from your end you can do and what more the medication changes, the precautions to make sure that these reports do not worsen over time. Again, these are worldwide screening tools, which I will keep on reiterating so that we all are at the same page when we discuss this. So if you have high blood pressure, diabetes, smoking, overweight, over the age of 50 now, earlier it used to be 60, or any family history of kidney disease, or do you suffer from any other kidney problems, any kidney stones in the past where your doctor has said just to be cognizant of your kidney function later, all of these, if you have, then you are at risk and you should screen yourself or keep a close follow-up with your physician or your nephrologist in these situations. So how do we manage the kidney problem? What are the things that could be done from your end? What are the things that could be done from your consultants, from your physician's end? And this is something which I think is very important is today's time is self-management. To take control of your own health and to manage the things that are going on is something that is becoming more and more prevalent in the community, which is great to see. We have so many of our patients coming and saying, sir, we just get an annual blood report done, an annual urine test done, we get our heart checked, we get our liver functions checked. And so that is a great way of owning a responsibility for your own health. And the more you know, the more you are aware of what to look for, it will empower you more to do better for yourself and even for your family. Just a word of caution here is we do tend to get carried away on the internet and try to surf a lot of articles which probably are not streamlined for a lot of us to gather the information that we need. So whenever you are in doubt, you always have your family physician, you have your nephrologist to guide you as to which of those informations are relevant to you, which might be harmful to you, and which might be helpful to you. So this is something that you should always take care when you are educating yourself as well. Now, I had told you we'll talk a bit about you understanding what the kidney reports are, and I have spoken in details about the GFR, the glomerular filtration rate, but I'll just touch upon the urine test as well. Now, every time you do, either you're doing it for your health screening, you're applying for a job, or you have applied for a job, and as part of your protocol in your institution or organization, you've got some lab tests done. You should look at your urine report and see if there are various parameters which are noted. And if you see that the one next to the protein, if there is plus sign written or plus written, even if it's written trace, it's a good idea to ask a physician as to what this means. As you can see in this diagram, inside a healthy kidney, basically the blood vessels are traversing the kidney and the filters are on the other side. And when through the blood and through the filters, the urine is produced, which contains the waste products, and the good stuff is kept in the blood. If there is any problem in the filtration barrier, then what happens is that the protein starts leaking into the urine. Now, it will be interesting for you to know that this could be one of the earliest manifestations of some kidney problem. You might have diabetes, you might not have diabetes or some other reason. Even before your blood pressures go up, even before your creatinine goes up, maybe this is one of the initial tests which is telling you that probably something is going on in your kidneys and you need to show your doctor about this. Again, owning responsibility of your kidneys. There are multiple apps which are there on mobile which help you target what your water intake should be. You log your blood pressures if you have high blood pressures. You can, if you want, monitor your urine output, though this is probably more for our kidney patients who have advanced stages of kidney failure to know how they are doing. If you are a diabetic, I'm sure your diabetes doctor or your family physician has asked you to monitor your sugars. And once you get your tests done, you can monitor your creatinine and your weight and other issues. Of course, a lot of you, I'm sure, would want to know what to do about your diet if you have a kidney disease, or even if you don't have a kidney disease and want to avoid having some kidney disease. Now, unfortunately, there isn't one right answer to this, because if you do not have a kidney problem, then if you are a diabetic, then your diet should be of one kind. If you have hypertension, it should be of one kind. Along the spectrum of your kidney problems, if you have advanced kidney disease, your diet needs to be modified to a certain way. If you're at the early stages, there are a few things that you can do. But having said that, there are a few rules which can be applied to everyone. And one of them is use less salt at the table. Try to minimize the salt intake over and above what you have put in your food. As you can see, 80% of the salt is already in our food, and we tend to eat out. We tend to eat junk food as well, and on and off, and it has a high salt intake, salt load. If on above it you are using a salt shaker on your table, then you are just adding to the sodium content. And basically what that does is it predisposes you to high blood pressure. And as I showed you that the prevalence, maybe 1 in every 4 people in this country might be harboring something which will predispose them to high blood pressure. This is something which we can do at our end. Of course, if you are a kidney patient, the best idea is to talk to your physician or dietitian or your nephrologist as well as to how much protein you can take. You shouldn't go overboard with your protein intake, and we recommend you to restrict it to a certain amount, though overdoing anything is harmful for your body. So we have to be careful that you don't get malnourished as well if you're a kidney patient. But this is something that you can look into. And I'm sure in all the medical forum which you have heard, eat food that are healthy for your heart, for your kidneys, and read the nutrition facts for sodium and other things to know what you're eating as well. Taking your medications on time to control your blood pressure, managing your blood sugar levels, trying to control your blood sugar is the best thing that you can do for your kidneys as well. Over a long period of time, we see so many of our diabetes patients having kidney issues, primarily because earlier when their kidneys were normal, they were a little bit, I wouldn't say not taking care of themselves, but probably not paying so much of attention to their sugar control. And this is not something which we're looking at 1 year or 2 years or 3 years time period. Like, this is our whole life. Over the years, the kidneys do get damaged if you persistently have high blood sugar levels. So that is something that you should be taking care of. Managing changes in your eating habits, diet, and nutrition, as I said. Losing weight if you are overweight, and getting regular physical activity. Of course, I am not sure if you must have gone through the social media, and nephrologists in Mumbai came up with this hashtag of ek chammach kam of salt, but it could be used to ek chammach kam of sugar and probably of oil as well. Again, there are, though not very stringent, but if you have already a kidney disease, then I'm sure you have seen a dietitian or you have spoken to your kidney doctor or your family physician, and they have advised you how to restrict your protein, what to do about your salt intake. As the kidney disease advances, the ability of the body to manage the sodium, potassium also goes down because the kidneys play an important role. And your phosphorus and potassium levels in the blood can go up. These are detrimental to other organs as well, to your arteries and veins, and these have direct implications on your health. So if uh, the ones of you who are listening, if you do have kidney disease and at a stage where your potassium and phosphorus levels also need to be taken care of, then there are separate recommendations for you wherein we try to restrict them to an extent where we do not restrict your nutrition as well at the same time. So it's a fine balance which we have to strike. And so it's always a good idea to be in touch with your dietitian or your doctor. Again, this doesn't harm having a low sodium diet, a low potassium, or a low phosphorus diet. The renal diet chart is made by the dietitian and it looks something like this. And it's individualized for every patient based on your vegetarian, vegan, non-vegetarian, and we can work on that. So, of course, a healthy lifestyle, if you already have a kidney disease, if you don't have a kidney disease also, of course, a healthy lifestyle helps you. Exercising daily, achieving and maintaining a healthy weight with diet and exercise, including good diet, minimizing oil, as I said, restricting the salt intake, having good proportions of fruits and vegetables, and eating more complex carbohydrates rather than ones which have high glycemic index, which your diabetologist or your dietitian will be able to guide you. And these are the some basic tenets on which you can work on. Again, as I said, because this is a forum in which I'm talking to people who don't have kidney disease versus some who have mild or someone who have an advanced stage of kidney disease, one size does not fit all. So what are the things we can do? These are the 8 golden rules which have been postulated worldwide. And though these seem like these are common sense things, but I think as part of prevention of kidney disease, these are very, very relevant for all of us across the society. So you keep fit and active, keep regular control of your blood sugars, monitor your blood pressures, show it to your doctor. They will do changes in your medicines if your pressures are going too high. Eat healthy, keep your weight in check, maintain a healthy fluid intake. Now, this is something also which I get asked a lot is how much fluid intake. And there is a myth that if you take too much of water, people go overboard with taking 4 or 5 liters of water every day and think that that will help the kidneys in the long run. It's not wrong, but what I would say is you have to do everything in moderation. The one advice that I can definitely give you is don't stay thirsty. If you do not have a kidney disease, make sure if you're working at a place where you don't have access to water, you should try proactively to stay hydrated. If you do have a kidney disease, then I'm sure we have discussed with you. If you are nearing your stage of dialysis or your dialysis and your kidneys GFR is less than 15 or 30 to 15, of course, we will tell you to restrict your fluid intake. But if not, then we can discuss it out as to how much roughly urine you pass in a day. And you can probably take that much amount of fluid to avoid yourself getting short of breath as well. Don't smoke or get help to quit. Don't take over-the-counter pills on a regular basis, which is very important because a lot of the times some of us have headache, some joint pain, some vague back pain. We try to take pills which we don't understand the way they work. And I would say if you do not have a kidney issue, more often than not, you get away with it. But if you are predisposed to it, like the risk factors that I told you, and you keep taking these medications do harm your kidney. And then we do see patients who have had high creatinine, and I'm asking them, they say that they have been regularly taking some over-the-counter pills. So try avoiding that and get your kidney function checked out. I'm sure if the ones who have diabetes and high blood pressure, your doctor must have checked it at least once. If you do have diabetes, then and your creatinine is normal, then it is prudent to at least get your urine routine checked for protein and your creatinine checked at least on an annual basis. And if you do have it higher, the reports are not in the normal range, then your doctor will tell you to do it more frequently. Again, what could we all do? So there are some things that you as a patient can do, as the community can do, some things that we as doctors can do, something which the healthcare organizations can do and the governments can do. So doing something like this where creating awareness about kidney disease helps. Prevent kidney stones, stay healthy. Again, I have reiterated these things. For patients who have recurrent kidney stones or have been having kidney stones, in them, yes, probably drinking more water to make sure your kidneys are flushed is a good idea, but this is a case-to-case basis. Diagnose and treat hypertension and diabetes early, protect your kidneys and save your heart. Be vigilant, prevent AKI, an acute kidney injury. So what can you do from your end? When it's summertime, stay hydrated. Don't take over-the-counter pills. Keep a regular follow-up with your physician. And if there is any doubt, then get yourself checked. Again, if you do have kidney disease, then a creatinine of 1.5, 2, 3, these are just numbers. Your doctors, your dietitians, your physiotherapists, we all are on board to adjust the medications to make you feel well, to try to stop the progression of kidney disease over time. We are going to do everything from our end as well. Unfortunately, yes, if you do have diabetes, high blood pressure, as you age, the kidney function can worsen. But we can try to prolong the progression of chronic kidney disease, going into dialysis and then to transplant. Again, a word of our dialysis patients. We have so many of our dialysis patients who do well over the years. And of course, we want our best. We do our best to try patients going on to dialysis and then needing transplant. But even if you end up on dialysis, there are so many dialysis centers, the logistical support, there is a plan in place, even if you are at the later stages of CKD. We have community fora, we have groups where we can talk and we can streamline your care as we go along the path of kidney disease as well. Again, so I'll end it with this, the 8 golden rules, which you can see. And as I said, a bend in the road is not the end of the road. So if you do have kidney issues, also it's not a worry. It's things that we all can sit together and work on it. And as it said, it's never too late to take control of your health. I would say it is never too early as well to take control of your health as well. So start now, and hopefully we from the medical fraternity are doing everything we can. We'll keep doing everything we can to make you more aware of your kidney problems, and you on your end can also keep doing this. Thank you. So I do have a few questions which I will take. Okay, so this is a very good question. Can you detect protein in the urine with the naked eye, and how? Or only a routine urine test will detect it? This is an excellent question. So at a certain point, I can give you the numbers as well. We kind of tend to pass around, say, 150 milligrams of protein in a day, of which 30 milligrams of it is albumin. Though it is different for different people, but if you notice at any point when you're peeing, it's generating a lot of froth, which is something like a detergent. If you have if you mix soap and the lather that is formed, that foaminess, if it's there in your urine, it could be an indication that you do have protein in your urine. So to the naked eye, if you have frothiness in your urine, is probably the one thing that could guide you, that you probably need to check your urine routine at least and see on the protein column how much it is. I told you the numbers because generally when it goes a bit higher, these things are manifested, but it can happen at a lower level as well. Okay, so the next question is CKD with Sjogren syndrome, which diet should I follow? And please advise about physical exercise. So for the other, Sjogren syndrome is a kind of an autoimmune disease wherein you have dryness of your eyes and you have other manifestations, and kidney issue can also be detected along with it. The diet advice for you with Sjogren or without Sjogren kind of remains the same. You restrict your protein. So it is said that you should have around 0.8 gram per kilograms of protein if you have a chronic kidney disease. So if you are a 60 kg person, somewhere around 50 grams. To be honest, us Indians, the kind of daily diet that we eat, generally we are a bit protein restricted to begin with. So don't go overboard in restricting your protein. I would suggest you should meet your dietitian or your nephrologist to know how much protein you can take. We will try to adjust your potassium and your phosphorus in your diet as well, by trying to not restrict your protein as well, because a lot of foodstuffs which has phosphate and it also contains protein. So you don't want to restrict too many things. And advice about physical exercise, I would say, as much as you can tolerate. Don't, if you have a heart issue, you shouldn't go overboard and try to do too much exercise hoping that it's going to help. You should live a healthy life. With your Fitbits and everything that you have now, you can try to target your steps as well. But my only advice would be, don't go overboard and trying to do extreme, hoping that it will help a lot. We kind of tend to, once we know that we have a problem, we're trying to fix it at a later stage by doing more, like drinking too much water, doing too much of physical activity. That could also harm. The next question is, does the basic full body test available in market also includes kidney test, or do we have to specify? If we need to specify, which test should we ask for? So great question. Generally, the basic body test does include your creatinine, but of course it varies from lab to lab. So if you want to know when you're checking on your basic blood tests, just have a look if you have your creatinine value also, which is going to be checked. And as I said, get your urine routine done as well. This would be the absolutely basic minimum to know if you have any kidney issue or not. So I hope that that answers your question. The next question is from Mr. Arjun Lahiri. The work from home schedule has deprived most Mumbaiites from the exertion of travel by public transport and unfortunately added tires around the waist. How does one get rid of the tires and avoid any preemptive kidney issues? That's a great question. So yes, I mean, as I showed you, you put yourself at risk if you become overweight or become obese. And if you do not have a kidney issue, then yes, I would suggest you to start exercising, start moderating your diet, have a fat restricted diet in place, try not to binge on junk food. As far as the kidney issues to avoid preemptively, I would say stay hydrated. Do not stay thirsty when you're, now that you work from home, but if you are at work and you kind of forget drinking water for the whole day, don't pee at all the whole day, and then suddenly in the evening you find yourself too thirsty, you're not doing your kidneys or your body any favor. But if you're working from home and you kind of are not doing your physical activity and you're seeing tires around your waist, then I think you should right now start taking control of the situation. Try to focus on what's your ideal weight and try to bring it down to the weight wherein you are not overweight at all. Mr. Vijay has said, my eGFR is 70. I'm 65 years of age. Thank you, Mr. Vijay. So just like I said, E in the GFR is an estimated GFR. So basically, if we want to know exactly what your GFR is, it would be a cumbersome process. We have to collect your urine samples, check your blood samples at the same time, and then calculate how much of the waste product you're excreting in real time. So that's not possible to be done every time. That's not feasible to be done, and it's not logistically feasible as well. So what we do is we check the creatinine, and based on your age and your weight and your height in some of the equations, we do come up with these numbers. Now I see that your GFR is 70. So you do have some amount of chronic kidney disease. So it would be worthwhile for you to get your creatinine checked on a regular basis. Now, one thing that I want to bring it up, and thank you for this question, is we all kind of think that the eGFR is 70, so both my kidneys are working at 70%. I mean, crudely that is true, but as I said, your normal GFR could be around 120. Generally starting creatinine GFR is around 120 to 130. And after the age of 40, we kind of tend to lose 1 ml per minute of GFR. So the value decreases by 1 for every year that you add. So if someone is 80 years old, the expected GFR for them is obviously not 120. It's around, say, 80 or so. So now if you have gone to the laboratory and the lab is giving you a value of a GFR of 70, then your expected GFR was 80 to begin with. So for you as well, if you see your age is 65, and this is again a very rough estimate, right? So even if I take 120 to be the normal, then 25 ml lower than that is your expected GFR at your age would have been somewhere around 100. So yes, 70 is less. And so all the things that I've said of monitoring your creatinine closely and being in touch with your family physician is the way to go. If you're diabetic and hypertensive, then if you do have diabetes and hypertension, apologies, then you should control it as well. Let me see the next question. I have kidney stone problem, 2 times already operated. What care should I take? Mr. Dharmendra Kumar. Thank you. So, like I said, each and every issue is a little different, and I've kind of given you a general rule. But in your case, if you have recurrent kidney stone problems, then you need to show your doctor and get yourself tested for it. Sometimes it could be something as simple as some anatomical issues with your kidney, which is not something that you or I could do differently. But there could be something which is happening in your diet, which you're probably taking more or less, or you are excreting a few minerals which are higher than the normal, the other people around you. So we need to identify what is causing these kidney problems on and off. Again, a general rule of thumb for you would be if your creatinine is okay and other parameters are okay, you stay a little better hydrated than I would say others, and make sure you drink enough water. And the kidney stone, what was the nature of it? What did your urologist advise you for some medications to avoid this kidney problems from happening? Is something that you could take forward. Again, just having a kidney problem does not mean you have a kidney disease. It's just a kidney passage. The stone is passed and your kidneys are healthy enough. So I would like to know more about what your reports are before I ask. But I think the basic idea remains the same. You work yourself up as to why you're having recurrent kidney problems and stay hydrated. The next question is from Mrs. Reshma Banu. How to reduce creatinine? So yes, that's a very valid question. Now, creatinine, as I said, is something which is produced by our body every day. It's just that we are checking the blood test to see how our kidneys are handling that creatinine. So to be really knowing as to if we can reduce our creatinine, no. But basically, I understand that what you're asking is how do I address my kidney issues? And I think from what I have said, addressing these 8 golden rules, staying fit is something that will help you prevent and increasing your creatinine and a kidney damage. Again, a lot of my patients come when they have higher creatinine saying that, will this medicine help in bringing the creatinine down? Will some other medication will help or not? There is no magic wand, to be honest. There is just these golden rules that you have to follow. Make sure you don't have an acute insult to your kidneys as well, and take it from there. Yeah, so Mr. Dharmendra is saying at present a 3 millimeter stone is also present in your right kidney. So yes, you should work yourself up as to why you're forming so many kidney stones. You can see a nephrologist or a urologist to guide you further. From Mr. Ramay, doctor, can you suggest any specific vegetable and fruit for good functioning of our kidney? It's a great question because these things keep coming up and we are asked these questions. Now, there is no fruit or vegetable that makes better functioning of your kidneys. I'll put it the other way around. If you have a kidney problem, then yes, there are few vegetables or fruits which you should try to avoid based on what your numbers are. So if you have a very mild kidney damage, then probably you can get away with eating the normal food in normal proportions. But based on how much your kidney damage is, if your potassium levels are high, then are probably restricting yourself to having fruits like apples or pears or lemon or jambul. And vegetables, unfortunately, the ones which we all like potatoes, uh, these are high in potassium. You probably are restricting yourself to turais, gourds, bottled gourds, and other things. But that is something you need to sit down with your dietitian to address. Now, if you do not have a kidney issue, then I would say have good amounts of vegetables and fruits in your diet. It helps in your blood pressure management as well. It helps in your overall lifestyle as well. And it helps your kidneys in the long run in that way as well. Mr. Vijay has asked any medicine to increase GFR, uh, not diabetic, but blood pressure of 130 by 85. Again, as I said, there is no medicine to increase your increase your GFR. There are medicines that can be withheld or not given so that the eGFR doesn't drop further. Uh, the only thing that I could probably think of is the over-the-counter pills that I told you. These are the things that can really hurt your kidneys if your GFR is borderline. So have a talk with your family physician. And if you ask specifically, is there anything to increase the GFR? Then no. But the medicines to be aware of that can decrease your GFR, there are quite a few of them. So you should be cognizant. Are you aware if COVID has directly caused AKI, acute kidney damage? That's a great question. Yes, COVID does cause acute kidney damage as well. There are various ways in which it could cause acute kidney damage. Patients can have concomitant other issues, like if they are septic, if they have other infections. The COVID virus has been shown to go and hit the kidneys by themselves as well. So by various mechanisms, the filter does get damaged. If you are a kidney patient and you have COVID, then the chances of complications are higher. So you should definitely get vaccinated. If you have with or without kidney disease, you should get yourself vaccinated. So yes, for your question, yes, COVID does have directly caused a Mr. Ashwin has asked, my creatinine value is 2.1 and GFR is 25.8. Blood urea is 68. Then I am having CKD. Yes, you do have CKD and you need to show your family physician. You need to sit down. If the family physician refers you to a nephrologist, you should show that to the nephrologist, and you should see your dietitian as well. Again, the same question, how to bring your creatinine level down. There is no magic pill. You control your diabetes, you control your blood pressure, you stay fit, you don't take over-the-counter medications, you avoid a few medicines that can hurt your kidneys. Sit down with your doctor and discuss. To whom should I ask about daily diet? To my nephrologist or a clinical dietitian? If you're seeing your nephrologist will be more than happy to sit down and discuss the daily diet. But I think a dietitian is a more appropriate person in this situation if you have, especially if you have an advanced kidney disease, because they will actually be able to make you a diet chart based on what you actually eat and prefer and work around that, so that all the requirements of a chronic kidney disease patients are also met, and you don't have to restrict yourself way too much to an extent where you don't even like sitting for food, right? Occasionally drinking 120 ml of whiskey is risky when my GFR is 70. Mr. Vijay, that's a great question as well. So having your drinks in moderation is okay. Okay, when you go overboard and you start hurting your liver as well and your kidneys as well, that is when things go bad. A social drinker is someone who probably has a 1 to 2 glasses of whiskey in a week. So if you're doing this daily, then absolutely no, but once in a while should be okay. But yes, moderating your alcohol, stopping your smoking helps a long way. Mr. Ashwin has said, age 58, weight 89 kgs, having high blood pressure and non-diabetic. So yes, you should get your creatinine checked, your urine checked, and then take it from there. What is the threshold below which a person is diagnosed with total kidney failure? So the absolute number would be less than 15. So if your eGFR is less than 15, then we are reaching a stage where we have to accept that both your kidneys are not working to an extent to take care of all the functions that it does. The first slide that I showed you, the number of things can go wrong now if the GFR starts below 50, 1.5. So, but as I said, I saw someone who has a GFR of 25. You should start being more cognizant of what's happening, seeing the rate of progression of your CKD. If the GFR is going down rapidly, keep a close contact with your nephrologist and plan ahead as to what is to be done in case there is the advanced CKD stage comes in. Last week, health checkup done at Hinduja, creatinine of 0.8, uric acid 5.6, calcium 9.6, and potassium of 3.7. Mr. Dharmendra, I think you're the gentleman who had a kidney stone problem. Yeah. So basically, this tells me that you do have kidney stones, but that hasn't reflected into any problem with your kidney functions as of now. But yes, I would strongly recommend that you should show it either to your physician or to a nephrologist as to why you are having recurrent kidney problems. Because see, if having a nidus, a kidney stone sitting there in your kidney can always predispose you to an infection there. And if that infection happens and it kind of involves the kidney, then this creatinine level might also start going up, reflecting that your kidneys are also getting. Of course, the kidney stone, if it becomes big enough that passing urine gets impeded, even then that can cause a problem. So yes, you should follow up with a physician or a nephrologist to see why you're having recurrent kidney stones, and a dietitian to see what else they can do from their end to restrict food that can predispose you to stone formations. Mr. Ashwin says my creat was around 1.54 since 3 years, but after COVID-19, it's risen to 2.1. What precautions to be taken? Now, I believe I don't quite understand that after COVID-19 means you got a COVID infection, or you were just in the COVID pandemic, you kind of lost follow-up as to what was happening with your kidneys. So either ways, if you had COVID and your creatinine has risen, yes, then that's something that you have to keep a close watch on. You have to get your urine test done, follow up with your nephrologist. If you did not have COVID and it's just been a loss of follow-up in the last 1 year or so, then it's a good idea to show your family physician, go through your medication list, see if you are taking of these, the presentation that I said, you're taking medications over the counter for any problem. Have you gone astray with your smoking, if you do, or something else? So there is no one answer to this question. I think for you, it would be better to sit across the table and discuss as to what could be the causes of this, or whether it is just a normal progression of your kidney disease. This could also happen if you have had a dehydration episode and you have a chronic kidney disease of 1.5, or any reason that causes an acute kidney injury, that can suddenly get your creatinine up. And then it doesn't come down to that level, that baseline level that we call of 1.5, and stays at probably a higher level. But this has gone up by 0.6. So I think it's a good idea for you to show your nephrologist or your family physician to know what's going on exactly. Is this presentation available on YouTube? I believe it is. I have to double check with my colleagues here.
This presentation is not available on YouTube. Having said that, if you could, drop a mail, then we could definitely share the relevant part of the presentation with you. So you could drop a mail on info@hindujahospital.com.
That's great. That's great. That's great. Ms. Reshma says, does pesticides in modern farming is the root cause of kidney disease? Well, I really don't think so. But yes, this is something that that has been looked into as well. But I am not aware of any evidence that has directly linked this to it. I would need studies, right? Evidence to claim or refute this question. So I'll leave it at that. Any more questions? Are we on time? So if there are no more questions, let me just be sure that is there anything. Okay, thank you. So can we wind up?
Definitely. Thanks a lot, Dr. Dey.
Okay. Thank you so much. And thank you everyone for participating. It was wonderful knowing there's such active participation from your end.
Thank you.
Thank you.